We're in the middle of a healthcare crisis. Doctors and nurses are burning out, waiting times keep getting longer and longer, and we face new challenges such as antibiotic resistance and new viruses. You might have heard of AI as this magical tool that's changing technology. And you might have thought about AI and healthcare and whether there's some applications. So I'm going to show you a few applications and why I'm really excited about this. Now, you might have already interacted with AI in some way, maybe with Siri, Google, Alexa, smart devices, or maybe you've seen or been in an autonomous car, cool. Or maybe you just watched Terminator and you think we should burn all this AI business to the ground. So maybe we should start asking ourselves, what is AI and why should we use it in healthcare? No, what is AI? So we first start with data, and data can come in the form of text, such as medical record, X-ray scans, such as images, and just data in the form of whatever, sound, stock market. All of this data gets analyzed by this AI system, which is just a pattern recognition tool. We're just looking at the data and seeing what's in there. The system undergoes a process called training. Essentially, what happens is that the model gets better and better and better at identifying these patterns. Now, you will see that it never actually reaches 100%, and if it does, in my experience, there's usually something wrong with it. So once you have a trained AI system, you hope to have something we call generalization. Generalization is when you have new data coming in, and your AI system is able to identify the same patterns. For example, if a new patient comes in your hospital and you get a chest X-ray, then you're able to understand whether the patient has cancer or not. Or maybe Elon Musk goes on a Twitter rampage and we can predict that the stock market price of Tesla is going to go down. And finally, search engines. You probably have interacted with search engines that identify the websites that you're most interested in. This is all cool. We can see how AI can be used in tech. Now, how about AI in healthcare, and why should we use it? The short answer here is to help doctors and nurses. And I have an example for this, Pajama Time. Now, for most of us, Pajama Time literally just means to get ready for sleep. Unfortunately, this is not the case for doctors. For doctors, Pajama Time means completing the tasks that they couldn't do during the day. And this includes medical records, maintaining them, doing bureaucratic work for the hospital, or simply keep up with the research. And it's no wonder that actually 2/3 of doctors mention burnout as the main cause of distress. Now, there are two main causes of burnout for doctors. One is paperwork, two, understaffing. Let's start with paperwork. As I said, there's a lot of paperwork involved when you have patients. You need to make sure that you take notes when the patient is telling you something important, and you need to make sure that you are listening. And the second one is understaffing. And for this, I have an example about job vacancies. Now, the data is only for England. Unfortunately, I could not find the data for Scotland. Now, we have job vacancies for doctors. So for every 20 doctors, only 19 of them are filled. So that means that there's one doctor job vacancy that is redistributed across the 19 other doctors. If you thought that was bad, nurses, for every 10 job vacancies for nurses, only 9 of them are filled. That means that the work of that one nurse is spread across the 9 nurses. And this is just the tip of the iceberg. Now, let's look at waiting times. Again, NHS England, sorry Scottish people in the audience. You can see that this is the number of patients on the y-axis for the last, I don't know how many years. Essentially, it goes up, and it goes up to a point where we're getting close to 8 million people. And this has gotten worse, especially after COVID. Now, for your context, there are 50 million people in England, 50. So that means there's about 1 in 5 people that are waiting to see a doctor. This is insane, and we have an aging population, so this is only going to get worse. So how can AI help? Essentially, you might have heard of this chatbot, really cool. Guys, that was not even a joke. You might have heard of ChatGPT. Now, it's a good friend of mine. If you don't know what it is, it's a smart chatbot. You can ask it questions, it will reply, hopefully with the right answer. But you can ask it to do various things like coding. You can help it write. You can help you identify new scientific papers. Now, I thought it'd be cool for ChatGPT to say hi to all of you before we start talking about it. And I believe this is the first time in TEDx history that this happened. So, yeah. So, I think there are three main ways ChatGPT can help, or technology thereof. One is for preparation. So before you go into a meeting with a patient, ChatGPT analyzes all the health records and tells you, well, you should follow up on these specific things. Second one is logging, and here I mean logging in the health record. So while you are with a patient, we want the doctors to spend as much time with the patient as possible. We don't want them to be taking notes. We want them to feel heard. So one way we can do this is to automatically record a conversation and then have a system that summarizes the main points of the conversation. And the third one is research. As I said, it's extremely hard keeping up with the research. It is for me, and it's even harder for doctors. The cool thing about ChatGPT is that it interacts with us with language. So if there's a new symptom that comes up in the patient record, it can identify new scientific research that shows maybe new diseases correlated with that symptom. So we talked about language. Now let's talk about images. This is an MRI scan, and actually this is work that I was involved in. So when you get an MRI scan, you get into this machine, and you should be very, very still. Because if you move even slightly, your scan will be blurred, like the one over there. Now, you can't do much with a blurred scan, so the doctor can either try their best to identify patterns, whether you have brain cancer or anything, or you will need to do it again. Now, this is extremely uncomfortable, as I said. So what we did is we took low-resolution scans, brain MRI scans, and we took high-resolution ones, and we taught an AI system to automatically increase the resolution of these scans. And now, from this scan, what you can get is something like this. Now, this, you can get it with the computational power of your phone. So it's very fast, it's very easy to run, and saves you time, saves doctors' time, saves patients' time. Very cool. My final example is retina scans. Essentially, when you go to an optometrist, they look at the back of your eye and see if there's anything wrong. Now, if there is anything wrong, they will refer you for a surgery, and they will also attach an urgency to that surgery. What Google DeepMind did is, based on the scans, identify whether the patient needed to be seen urgently or not by a healthcare professional. And now, I have the data over here. This is the error rate on the referral decision. You have optometrists, retina specialists, and AI. Now, you can see that the eye matches more or less the performance of the healthcare specialists. So this is very cool because, again, these models run really quickly, and they can be deployed in areas where there just aren't that many doctors. You can use them to pre-screen the population so that these high at-risk people can be seen by the doctors. Now, it's important here, I'm not saying we should replace doctors, we should help them. You might have noticed that the error rate was never actually 0%. And I mentioned this is a problem in AI. So we should think about what happens when it makes mistakes. Now, I've prepared a 5-point, non-exhaustive list of what happens, like the problems that we might face, and ways we can mitigate them. So the first one is bias. We don't want the bias in society to be spread around. So one way we can do this is make sure that the populations in the data are well represented, and we can do audits. So different companies can check that the models that are deployed are working well. The second one is transparency, and now this is a really hard one because it's really hard to open up the AI system and understand why they made a specific decision. And I think here the only real solution is to look at the open source code. Now, open source code means that you and me can access the code for free and understand what happens under the hood. Privacy. Of course, we want our data to be private, so it needs to be encrypted, and we want data minimization. So we don't need to collect all the data we possibly can about a patient. We just need the data that we need. Accountability. So when it makes mistakes, there should be a person or an institution that's responsible for those mistakes. And there should be user feedback. So if the AI makes mistakes, we should learn from them. And finally, safety. Of course, we want something safe to be deployed, especially in healthcare. So one problem here is called hallucination. Especially if you use ChatGPT before, you can see that it confidently tells you something even though it's false. And you can argue with it, and it's like, no, it's false, and it continues. So it is a big problem. So we need to make sure that when these models are deployed, they're fully analyzed. And there should be fallback strategies. So if the AI system fails, there should be a human taking over the AI. Now, this is all cool. I talked about AI and all the possible applications. Now I'd like to talk about the next frontier. And the next frontier is proteins. That wasn't a joke. It's actually my PhD project. So you might think of proteins as the things that you eat before you go to the gym, but actually proteins do pretty much everything in the natural world. You can think of them as Legos. Now, as a kid, I used to love Legos because, because as long as you have these instructions, then you can build your own spaceship or whatever. It's very cool. And much like that, proteins are made of these building blocks called amino acids. And you can put them in chains, and when you do, you create these proteins. I like to call proteins the architects of life on Earth because, as I said, they do pretty much everything. I'm going to show you a few examples of this. You'll know plants. Plants do photosynthesis. So this big guy over here is rubisco. It helps with photosynthesis. It's one of my favorite proteins. This is DNA. DNA needs to be replicated, and to replicate DNA, we use DNA polymerase over there. So what I'm trying to say here is that as long as you have instructions, which come in the form of DNA, you have your building blocks, which are amino acids, then you can build your spaceship or a protein. And now, as my final example, I have this thing that you should be familiar with, COVID-19. This thing sticking out, you guessed it, it's a protein. It's called a spike protein. And you might be also familiar with this other protein called an antibody. Now, what happens with antibodies is that they attach to the spike protein and they initiate an immune response. Now, to do this, we actually need to create lots of different random shaped antibodies until we find the correct one that matches the shape of the COVID, and we initiate the immune response. This takes time, a long time, which is why it takes us time to heal up from diseases. Now, believe it or not, this is actually a similar approach that the pharmaceutical industry uses in finding new cures. Essentially, they have lots of compounds, and they dump them all at the problem and try to see which compound actually decreases the side effects or cures the disease. And this is really time-consuming. So what I'm proposing here is to use AI. And I have an example with COVID. So if you have a spike protein, like the one I showed you earlier, you can ask an AI to dream up the shape on an antibody, or like the most probable shape on an antibody that will bind COVID. And now, you can ask it to design, based on that shape, the actual antibody. So there we have it. Instantly, we generated a new antibody that we know will bind COVID. And the cool thing about this is that if we have new viruses coming up, then we can instantly generate new antibodies for those viruses as well. Cool. Now, much like any new technology, we need to be careful. We need to make sure that we know how to use AI before we deploy it. But I believe that once we will be able to do that, it will change the world. Thank you.